Good morning or afternoon, depending on where you are, and welcome to the series, Viewing Multidimensional Poverty from Many Angles, coming to you from the George Washington University in Washington, DC, Oxford University in Oxford, UK, and the United Nations in New York City. This is the second episode of the Spring or Lent series, which explores the Multidimensional Poverty Index, or the MPI, and how it can be used in theory and practice. I'm James Foster, Chair at George Washington University, representing the Institute for International Economic Policy, or IIEP. And I'm here with Anna of the Oxford Poverty and Human Development Initiative, or OPHI, in the Department of International Development of Oxford University. And along with our colleagues at the Human Development Report Office of the UNDP, we're pleased to offer today's presentation, Optimized Multidimensional Poverty Reduction, a model based on policymakers' capability. Well, that's the original name. Who knows, when the presentation comes along, it may have a slightly different name. Today's presenters are Vladimir Hlasny and Hassan Hamie, of the United Nations Economic and Social Commission for Western Asia, or UN-ESCWA. It's one of the 5 regional commissions under the jurisdiction of the United Nations Economic and Social Council. The discussion today will be provided by Paul Makdissi of the University of Ottawa. In just a moment, I'll introduce the speakers, but first I'd like to express my appreciation to the teams at IIEP, OPHI, and HDRO for their continued help in making this series possible, including Remy Jedwab, the director of IIEP, Sabina Alkire, the director of OPHI, and Pedro Conceição, director of the HDRO, and to the continued financial support of IIEP's Executive Circle, and from the Elliott School of International Affairs at GW. As usual, the seminar is in person at Oxford, where Anna is located, with online activities being coordinated by the masterful team, coordinated itself by Kyle Renner, usually. The people who are operating the electronics are students at the George Washington University. So thank you so much, Justine, for being here to help us out. Last week, the MPI series brought Prince Adeyemi Adeniran, Statistician General of Nigeria, and Solo Afoloyan of the Presidency, who is the National Coordinator of Nigeria's MPI project, to discuss Nigeria's national MPI. Next week in the series, Kirsten Senbrook of the London School of Economics and Mauricio Apablaza of University de Desarrollo in Chile will present Multidimensional Quality of Employment in Latin America, with discussion by Josefine Pasanen of the HDRO. Please join us. But if you miss an event, you can always catch the reruns on the YouTube channel, IIEP GW. Now for today's speakers. Vladimir Hlasny is an economics affairs officer with the UN and Social Commission for Western Asia in Beirut, where he is on the Poverty and Inequality Research Team. Before that, he was a professor at the oldest modern university in South Korea, Ewha Women's University, which, if you watch Korean serials like I do, has produced some of the most prominent actors in Korea. Vladimir works on inequality, and more specifically, inequality in the tails of the distribution, with many other publications in labor and welfare economics, particularly in the Arab or Asian regions. Hassan Hamie is also an economist at UN-ESCWA Beirut in the Inequality and Poverty Unit. Before that, he worked at the Lebanese Petroleum Administration and at the Energy Economics Group of the Vienna University of Technology, where he published a number of papers modeling and analyzing energy markets using statistical, game theory, information, and forecasting methods. Our discussant is Professor Paul Makdissi of the University of Ottawa, where he teaches courses in microeconomics and public economics and writes a ton of papers on poverty and inequality, especially inequalities in health, and another of my favorite topics, stochastic dominance. He's an associate editor of the Journal of Economic Inequality, past president of the French-Canadian Economics Association, and has many other distinctions listed on his bio. He also has a strong connection to Lebanon. Thank you all for being here. First up, I guess, will be Hassan.
Thank you, Professor James. I'll be presenting the work that has been done by myself and the whole poverty team at ESCWA. My colleague, also Vlad, will be joining me in this presentation. So the tentative title of the presentation is Poverty Reduction Optimization, where we will present some of the models that we have developed internally, basically still at the theoretical stage, but we hope that it will be also practiced someday. So there's a big need for a poverty reduction planning tool in order to meet the 2030 SDG targets, mainly SDG 1, which talks about which mainly talks about income poverty and multidimensional poverty. From the income poverty point of view, and over the years, important academic work, whether it is statistical or economical nature, has been done either on the poverty line side or on the distribution of incomes and expenditures or on the growth sides. And also, besides measurement, targeting programs for the income poor people have been developed, such as the proxy means testing. So lots of progress has been done on the measurement side and at the targeting side. How about MPI? On the MPI side, there's the well-known Alkire-Foster method that talks about the measurement. And how about targeting? And this is what we hope to present today, some models that help practitioners target specific people. And we hope that this presentation sheds the light on some of the important topics. So as you can see in front of you, the SDG target talks about main general sentences such as mobilize resources to implement policies, to end poverty or to reduce poverty, and create pro-poor gender-sensitive policy frameworks, etc. And on the graph that you see in front of you, we have two interesting properties of the MPI, which is the intensity of poverty and the headcount ratio. In contrast to the income poverty, not only it is important to reduce the headcount, but it's also important to see those that are still poor. How poor are they? So for example, Ethiopia, you can see an arrow on the right side. This is a time forward in time. So Ethiopia, if we look at if we follow the arrow, the last 2 points of it, we can see that we have an increase in the headcount and a decrease in the intensity. How does this affect the MPI? We don't know. We have to see the numbers. However, in Tanzania, if we look at the last 2 points, there is a reduction in headcount and a reduction in intensity, which entails a reduction in the MPI. So these should be important while talking about the policies for poverty reduction and when talking about the MPI. And despite their strong assumption, nowcasting or forecasting or simulation exercises for computing poverty indices remain an essential target from a policy perspective. So the assumptions for our poverty reduction strategy mainly starts with the overall goal. What is it? What do we need to do? We need to reach a preset target MPI, of course, lower than the existent and baseline MPI. In the future, I would like to reduce my MPI. So this is the objective function is around this index. While we have to couple it with another thing in order for it to become an optimization model, an objective function and some constraints, mainly targeting the idea of minimizing total effort. The effort is not well defined here. It's kept as a general. It could be anything. It could be resources. It could be time. It could be human resources. It could be a certain policymaker who has let's say, an electoral campaign, and he would like to minimize in the next candidate term of him, 2 years or 3 years, the MPI or something like this. So it's not well defined at this stage. And then for each MPI indicator, this policymaker is able to specify some of the effort, or how much is the effort that is required to remove a single household from deprivation, becoming non-deprived in a certain indicator, and how will this affect the overall MPI at the end. The effort is assumed to affect a single indicator. This means that if I induce a certain effort in a certain indicator, I will only have an influence on this specific indicator. It will not trickle down to other indicators. This is a big assumption. And the final results of the optimization will be, it will give us the optimized efforts required per indicator to attain this MPI target. Okay, so a general sentence would be, to reach an MPI reduction of 20% in the next 10 years, you need to focus on indicator 1, 2, and 3, an example. So what type of models we have? We have on the x-axis the type of intervention. It could be at the household level, where the state is assumed capable of targeting specific household categories in its intervention across specific indicators. Why do we mean specific indicators? Because the policymaker can influence some of the indicator and was unable to influence other indicators. It remains an essential point in the capacity of the state. And who are the specific households? Well, in this model, it targets mainly the poor households, okay? And the most optimal flip here in this case is the one whereby a deprivation flip will lead to a change in MPI poor status. The other type of interventions are mainly geographic, and they target deprived households instead of only poor households, okay? So a more realistic representation of the state that assumes that the state can choose the indicator, as we did in the model before, and demographic cell it aims to target when planning its intervention. However, not all deprived households may be lifted. So, for example, in this case, the deprivation switches can be done for the following criteria. Either I can target a deprived household in a certain indicator, whereby I remove the deprivation of this household. However, I'm still MD poor or multidimensionally poor. Or if I remove the deprivation in this indicator, I become non-poor, or even I target a certain MPI deprivation for a certain household that is not even MPI poor to start with, okay? Finally, by conception, the case whereby non-MD poor households switch to MD poor is not theoretically defined in this concept. So as a summary, this model targets the indicator where there's a high ratio of deprived households that are MD poor. So it focuses on these type of indicators. Wherever this ratio is high, the model targets this indicator. And whereby the MD poor status change of a household can be achieved by only switching the deprivation status in this specific indicator. It's like a probability. It focuses on these indicators because this is where the high likelihood of probabilities is. So this is the most optimal way, okay? And whenever the cost element is added, then also the model will focus on the least cost as well. So the model focuses on different directions, while at the same time, if we agree that the resources, if you remember, while minimizing the efforts is defined as the cost, we have to go to the least cost, not only from the MPI perspective. From the vertical axis, we have the type of active inputs. We have the individual indicator. As I said before, the effect of effort is indicator specific and it does not trickle down to other indicators. Or we can do it at the cluster indicators. It means, in other words, the dimensions. We introduced this in order to increase flexibility because it's nearly impossible to assume that the indicators, there's no trickle down or the indicators are not, there is some sort of dependency between indicators, even if I do an effort for a certain indicator. So we assumed the complete opposite case, which is within a dimension, a certain effort in an indicator will surely trickle down to the other indicators, all right? The household models, both of them are deterministic because, again, we're targeting the MD poor households. The demographic cell level and the national level, with both of them are geographical targeting, are non-deterministic. And we have to observe the societal response. Every time we run the model, there would be a different random societal response. And then when we observe this at the different iterations, we can see how these things affect the model. Just to give you an idea of what non-deterministic means, let's say that I have a subgroup composed of 6 households, a household that is poor, a household that is 2 households that are deprived and non-poor, and the remaining 3 households are non-deprived and non-poor. In the first one, the model tells me, and any one, the model tells me that you have to flip 2 households in order to reach your optimal household, your optimal MPI in this specific indicator. And run 1, the 2 households that are flipped are 1, the household that is poor, the one in green, and the other household 3, which is deprived and non-poor. Whereas in run 2, household 2 and household 3 are flipped. The effect on the MPI is different. In run 1, both the headcount and density have changed. And in run 2, only the intensity has been modified. The headcount is still the same because the household is still poor. So this is what we mean by non-deterministic. And we do that, we do the modeling different iteration, and then we observe the relationship. Some additional model flexibility were added, and we distinguish 2 types of active indicators. Again, active indicators mean that a policy, instead of activating all indicators, will only pick the indicators where they think that the state or their campaign or their resources can be targeted. We have public good indicators and we have private good indicators. The public and the good indicators are indicators whereby the state owns the whole value chain and it can act as in-kind support. Let's say a sector like electricity or the water supply or any infrastructure related indicator. The government controls the whole value chain and it can support it can provide the support needed. Whereas in the private good indicators, it's the other way around. The government can supply, for example, cash and transfers, conditional or unconditional, to households, and then they would decide how to spend this money. Okay, so for the public good indicators, the active indicators that are labeled as public good indicators, we will run the demographic cell or national level, where the model focuses on the deprived households. Whereas in the private good indicators, the model can either be household level, we target the MD poor and we give cash transfer to these people, or it could also be demographic or geographical, as we can say. And we've added some additional flexibility that distinguishes between type of households, which is income proxy or expenditure proxy or whatever data available we have that help us in identifying different type of households. We've added this slide. I will not go over it, but I will provide it in the PowerPoint material and we can share it with everybody later on. Some important model features. First, the Poverty Reduction Action Plan. How does it work? How does any of these models work? We have several steps. A policymaker will start by step 1 from an HIKE survey or a DHA survey and a baseline year. They compute the baseline MPI and all its poverty disaggregations. Then we map the active indicators. Then we map the active in-kind assistance or in-cash assistance. Indirectly meaning we identify what are the public and what are the private good indicators. Step 3, we identify and match indicators to relevant ministries. This is important just to parameterize our model. Remember, we have a certain effort per flip that we need to measure. And this is an input assumption. And thus we can have it from line budget ministries and stuff like this. So this is an important step. Step 4 is to pick the appropriate model from all the models that we have discussed and parameterize it. Then we can define targets and timelines. And finally, we can prioritize, we can talk about the results. If you remember, I said the result could be to reach that target. First, can we reach the target given the resources we have? Second, to reach it, which indicators should we focus on? And as you can see on the left bar chart, horizontal bar chart, we have the different models. and that are distant with this different distance for every consecutive models. You can see that they are situated on a, I would say, a scale level, and the scale is from least efficient to most efficient. What do I mean by most efficient? I mean by most efficient that the model that gets you to the MPI target with the least deprivation switches. Because again, why least deprivation switches? Because each deprivation switch costs money, and which we're doing while minimizing the effort. That's how the model functions. You can see that the household model, where we're targeting exactly the household that are poor, is the most efficient. However, this is in reality non-realistic, because the state is incapable of targeting exact households, irrelevant of the geospatial place where it belongs and the infrastructure around it. Then we have the targeting ability. It's an important feature we have in our model. It can distinguish between different types: deprived household at national level, at geographical level, household type by income consumption patterns. These are the clustered one, and the MPI poor household target precisely. Then we have the type of transfer for active indicator, in-kind versus unconditional can transfer tailored to household needs. And finally, we have an important feature, which is the resource waste. Waste from aid going to deprived and non-poor households. There's a bar above the H that can't be seen, at least in front of my screen. So for us to have an optimal way, for us, we defined it as the MPI poor people. So an effort going to deprived and non-poor households is a bit inefficient. Also going to poor households without lifting them from poverty, however, lifting some of their deprivations in some indicators. And finally, moral hazards, which is mainly defined as household using the cash and transfer provided by the state. However, they are not consuming it to ameliorate or to have better deprivation score. They are using it for something else. Finally, other possible optimization model that we also are developing, it could be very simple. And we can benefit from the already existent Alkire-Foster methods and disaggregated results. We have the uncensored, the censored headcount, and the MPI contribution. These are all disaggregation results at the indicator level. So the uncensored considers the concentration of deprivation in a certain indicator. Also, when statistical weights are involved for households, this goes into the equation. The censored considers the ratio and the extent of the deprivations among poor, not only deprived. And the MPI contribution factors in addition to the censored headcount concept, the weight of the indicators, which is one of the normative assumptions done at the early stage of the MPI framework build-up. So now that I know which indicator has the most MPI contributor, or this region is the most contributing to the MPI, from a policy point of view, I can target this indicator first. For example, to be simple and to discount the use of linking it to another factor, which is sometimes not easy to compute, like the cost per flip or the efforts per flip for a certain household in a certain indicator. This is irrelevant. You don't have to measure these stuff. So as suggested, the optimization model can thus focus on finding the deprived and poor household in a certain domain, the most contributing one, whether it is an indicator, whether there is a certain area, or whether it is anything. Initiate deprivation reduction by allocating more resources to that specific domain, and then observe the societal response. Let's say, as a policymaker, I have an MPI target of 20% reduction, and after implementing this, I did not reach the target. I then can recompute the MPI all over again, see if this area or indicator or region is still the most contributing. If it is not, then I move to the second most contributing or to the new first contributing. And this is how it goes. Finally, a small illustration to show you what we're talking about empirically. We have a subset of a real sample hike survey of Egypt. We have a binary deprivation matrix from the 2018 survey. We have X number of households, 22 indicators. Each household is, as you know, characterized by the size, the sampling weight, and the demographic information. we have the poverty cutoff, and we have the dimension and the indicator weights. In this illustration, we only chose to activate 4 indicators because we think that the policymaker that using this model would like to focus on these. 3 of them are private goods, whereby the policymaker can give cash and transfer to people. And 1 of them is public good, whereas the state control the value chain, and it can provide the resources needed. It can build a thermal power plant in a region, for example. The results are the MPI is 0.176, the headcount is 35.5, the intensity is 36.4, and we can see the values of the contribution to the MPI. It's clear that the social assistance were the most contributing indicators among the 22, not among the 4. And to parameterize the model, we just give you an example. Marginal resource needed to lift a household above a certain cutoff of deprivation in an indicator is 6 effective units, for example, for school attendance, and the feasible range is between 0 and 6,000 in that case, which means that out of the 12,000 households, there are X number of deprived households in that indicator, and from these X, I can switch 1,000 households in this indicator. This is what it means. I'm giving the state the capacity and capability to switch them. Now, will the model pick them all, half of them, to reach the target? This all depends on the ratios that I've spoken before and on the cost and flips. As we can see here, the results. Yes, so we have several types of results. We have the number of households lifted from poverty per model, number of households lifted from deprivation in a certain indicator, or overall the active indicators, maximum number of deprivation per households that are lifted, headcount poverty, intensity of poverty. We can see that in all models, the 20% reduction preset target is reached. However, different results for headcount, different result for intensity, and different efficiency depends on how you as a modeler or as a policymaker, you want to define it. If I want to define the efficiency being I'm reaching the target with the least number of flips, then obviously the first model is the correct one, is the most optimal one. But is it realistic? Can the country and the government really achieve that? We don't think so. We think that the demographic level for public good and cluster level for private model is the one that most likely mimics a reality. Okay, but also this is, yeah, theoretical. Finally, I can also show you how efficient the cluster is. So if you look at the right-hand side of this slide, we can see 6 clusters. Our clustered models has distinguished 6 types of households. If we see the average income per cluster per capita, if I want to assess it, 3 of these 6 clusters have a really low mean, which means these are the poorest households. Okay, a cluster 3, 5, and 6. And if you can see how many flips are recorded among all clusters, we can notice directly that the model is going towards these clusters. It means the clustering is working properly in assessing and helping the cluster method targets the right households. That's it from my side. Vladimir, do you want to add something?
Yeah.
Yes.
Thank you so much, Hassan. I will not take, I know we are a little bit over our time, so I will just say, add maybe one last minute to this discussion. So we've heard how the models work technically, and I hope everybody got the flavor of the variety of models that we have explored. And maybe I will say just one thing about that, we started this work in our larger team led by Khalid Abu Ismail, who is among the listeners here. We started with the perfect information, perfect possible interventions by policymakers without kind of budget constraints. What Hassan referred to as the household level model, where the state has perfect information about the deprivation in each indicator and multidimensional poverty status of each household, and can act at the level of households. And we heard a lot of kind of pushback, even among ourselves. We felt that this was unrealistic, and then from various other teams, social justice team, social protection team, and our member state representatives felt that, well, where do we get this information, or how do we act on the recommendations from these models? And so we developed more varieties of the models. So at this point, we're kind of at maybe third generation. We started with these, with some simple models, perfect information, and then the opposite end of the scale of kind of zero information, nationwide targeting. In the second stage of modeling, we thought, well, let's distinguish by type of indicators, a type of goods, where somewhere we can correct deprivations with cash given to certain groups. In some areas, it's impossible to give it to small demographic groups, the public good indicators, where the government has to intervene at a regional level or kind of or national level. The results are not perfect. The results that we have currently are just give kind of flavor what is possible, and we're exploring what else we need to make the models more realistic. The latest kind of generation that we are working on now is where we just, let's say, give up. That we don't have the costing information, and that's what Hassan was describing toward the end. What if we only know we have the deprivation matrix, we know the contributions of indicators, but we have no information on costing. How could we, what kind of preliminary recommendation could we make to policymakers? And we are currently implementing this kind of no costing poverty reduction optimization scenario. By the way, one thing that we haven't mentioned is that this work is being implemented online. There's an math tool at ESCWA, the Multidimensional Poverty Assist tool, and beside building MPI frameworks and so estimating the results, and then imposing shocks, let's say shocks due to COVID, shocks due to economic crises, and seeing what changes in MPI we could expect. We've added this optimization module where the users can choose the desired reduction in MPI, the choice of active indicators to affect, and either do a no costing version and see which indicators the policymakers should in fact be focusing on, or the costing version where the user can input some measure of costs and do a simulation for a particular country with particular circumstances on how to achieve that MPI reduction target.
Oh, okay, well. Thank you so much, Vlad. That's wonderful. And thank you, Hassan. Before we move on to Paul, I just want to let the people in the audience know that they have their chance to ask questions, and you can be formulating them now to put into the Q&A function of Zoom. And now over to you, Paul.
So thanks, Vlad. Thanks, Hassan, for the presentation. Let me share. I've prepared a few slides. So are you able to see my slide?
Yes, we can.
Okay. So the comments will be more on the paper that I had in hand than the presentation, because I've prepared them in advance, except the title. I was able to to change the title during the presentation. I think, and I strongly believe, so there is a lot of work in that. So the paper makes an important contribution, and I'm always excited when I see these guys who are at the frontier between these policy, the real policymakers and academia. The kind of work they do, I think it's really inspiring. So I think they make an important contribution. So you want to reduce the MPI, of course you can think of some policies that are based on your belief, or you can use some simulation models. And I think even if simulation is not reality, it's a step toward reality. And what they're proposing here, I think, is the appropriate thing to do. They even do some simulation with some costs. They use the best information they had to fill this cost, and they're very, if you read their paper, they're very, very cautious in the paper, saying, okay, here are the costs, but if you want to do this for real, be careful, this has to be cross-checked. And I strongly believe that their exercise offers a proper cost-benefit framework for the policymaker who, I will use the exact word they use, for the policymaker aspiring to reduce multidimensional poverty. Of course, I have some questions, and as you will see, probably the questions do not focus exactly on what has been presented today, but I think it's worth mentioning. So I'm happy that they use the exact same illustration that I was reading in the paper. And in the MPI, I know that you have constructed an MPI using the household income expenditure consumption survey for Egypt, but you're not using neither income nor expenditure. And I was a little bit surprised, and you'll see on the next slide why this may have some consequences. So for instance, you're in the Arab region, you know that the Palestinian MPI, they use equivalent household expenditure, and they consider it so important that they give this indicator a weight that is equal to the cutoff. So if an household is deprived in income or expenditure, then is automatically considered poor. If I'm correct, I may be wrong, but if I remember well what I read.
20%.
Yeah, so why don't you use in your model? So some countries have these household surveys, income and expenditure survey available with other MPI dimensions that are included. Why don't you use income? So if I'm correct, if I remember well, this fantastic paper that I've read of Sabina and James, in their seminal paper, they use the income information that is available in the NHIS data set that they use for the illustration. So from my perspective, when income is available, use it, always use it. Then this brings to my next question. So you have this social protection dimension that you use in your model. I'm not convinced that this is an indicator of deprivation. It's a measure of the targeting efficiency of the tree program in Egypt. So if you had income instead of that, then I think it would have been better, but I may be wrong. I'm not the specialist of Egypt, and I know that in your team you have people who know Egypt better than I do. This was in the presentation. You rightfully distinguish between the indicator that you can target at the household level and some that are not possible to target at the household level. But at some point you say, recall that in-kind transfers carry their own potential inefficiencies, not least because some resources are wasted on deprived yet not multidimensional poor units. Maybe this is a consequence of not including income in your MPI. So if you include income and you include it in the same way that you include that the Palestinians are including income, then if you're reducing deprivation in the income dimension, then you automatically reduce a count, at least not necessarily a poverty count, but at least you reduce the contribution to A in your measure. when the intervention is at the household level, you also discuss the possibility, and you discussed it in the presentation today, that the household redirect part of these transfer for purposes other than the targeted indicator. There are two ways that, and you mentioned one of these ways that policymaker use to make sure that the household uses at least most of the transfer for the targeted indicator is to introduce some kind of conditionality. But we know that conditionality may impose a burden on the poorest of the poor. And typically, this is where the burden of conditionality will be felt. There are some interesting field experiments on labeling. So labeling doesn't impose a burden. So you have an interesting paper of Ben Hassan and some co-authors, and this is in Morocco, so it's appropriate for in the Arab context. And you have also a more recent paper of Enrich and Knowles that have been published using experiments on labeling. And it seems that if you label the transfer, even if you don't have conditionality, it has an impact on how the household use the transfer. Probably it changes the power of negotiation or bargaining power within the household, and may give more power to female who are typically more enlightened than men in using these transfer. Now, I will focus, and this will be my last comment, on the way you're here I've put a formula that you have in your paper, the way the optimization model is looking to reduce the MPI. So you're talking about prioritizing region or groups or demographic groups for which the ratio 1 times ratio 2 has the highest value. And here it's the exact expression of this multiplication. So you're targeting a group or a region where you have the highest proportion of deprived household in a dimension that will become non-deprived and non-poor after the transfer. So this is how you choose that. And of course, it's the right thing. This is where you will get the highest bang in terms of MPI. Why? Because these households will cross the deprivation threshold in that dimension, will also cross the poverty threshold in terms of count, and it gives a higher reduction in MPI. So you should be cautious for some reasons when you do that. First caution, when you target at the group level, you should complement also by a political impact assessment. So Hassan, you're Lebanese, and you know that if you target a specific region or a specific group, this may create tension, and this may has to be included. So maybe we should think of ways to have national program, but that are designed in a way that will automatically target the right groups without specifically targeting the right group. And now my really last comment is just a small theoretical exercise. So assume that you have 3 dimensions, okay? A word with 3 dimensions, 1/3 of weight for each indicator, one indicator per dimension, to use the same kind of vocabulary that we use when we talk about MPI, and assume that in this word the poverty threshold is 2/3, just for this exercise. And consider that you have 2 poor individuals, Khadija and Layla, and they are both deprived in dimension 1 and 3, so they're both above this poverty threshold. And you have this policy that has just enough resource to lift one out of deprivation in dimension 1. I've did this small graph. So forget dimension 3, they're both deprived in dimension 3, and this will not change. So we have the 2 dimensions that remains, dimension 2 and dimension 1. And here you have Layla and Khadija. So using your optimization model, your resource will be transferred to the region where Khadija is. And this will lift Khadija out of poverty. And this is the policy option 1. And what was her contribution before to the MPI? It was 1 divided by n times 2/3, and then it jumps to 0. What happens if you had transferred these resources to the wrong person, according to your optimization, Laila. Her contribution to the MPI will have go down by only 1/3 instead of 2/3. So you're doing the right thing if your objective is to reduce the MPI. But let's consider now another exercise. Assume that instead of 2 policy options, you start, the reality is policy option 2. So Laila is can you see my mouse on the screen when I move it? Yeah, so Laila is there and Khadija is there. So nor Laila nor Khadija is the vector dominating the other one. And if you move from the outcome of policy 2 to the outcome of policy 1, it's like moving Laila from here to here and Khadija from here to here. This is an increasing correlation switch. And what happens is that you start from a situation where nobody vector dominates the other one to a situation where Khadija vector dominates Laila. And I'm not sure that this is not an important issue. I'm not asking you to change your model because your model is doing the right thing, but I think that in future work, in the future, we should think of ways to avoid this kind of reallocation in the model. And that's all I had to say.
Well, thank you. Thank you so much, Paul. Very good. The last example, of course, pointing out how inequality and poverty may move in different directions at the same time. That is interesting and intriguing. Also, the discussion of how income might be included in MPIs. It's not always. It's up to the country, of course, who puts in income or not. Some consider it to be extremely important. I wanted to let our speakers get their 2 cents in to respond to Paul, and then there's a few questions in the Q&A.
Yes, so from our side, Khalid, can you please unmute? Yeah.
Well, greetings from Beirut, Professor Foster, Paul, Professor Paul Makdissi. It's a pleasure to be here, and like to thank you again for hosting us. It's really very important to have this conversation. It helps us refine and go back and sometimes even rethink the modeling work that we do, which we try to make to the benefit of policymakers. Now, Paul, you make a very interesting observation about income, which I'd like to respond to. In this particular case, obviously we didn't think about including it because it wasn't part of the framework. Now, when you do, as you know, when you do an MPI, you engage in consultations, and it's a very wide process of consultation. So you come to the table and you have the government, you have various ministries, you have the experts, non-governmental organizations, and you agree on a framework. So what we presented was based on a framework that is currently being finalized with OPHI and UNICEF and other partners led by the Ministry of Planning and Social Solidarity in Egypt. Now, whether or not you should include income in the framework of the MPI is a normative position as well as a technical. Okay, I'm of the opinion that one should not. One should separate and try to, as much as possible, when doing this work, to isolate between the income poverty or monetary poverty, money metric poverty issues, and between the MPI. And if making the fusion, as in the case of Palestine, risks blurring the very different dynamics that you have for addressing income poverty and multidimensional poverty in non-income space. So for that purpose, I think even though income is addressed indirectly by looking at the families who are deserving of social protection but not receiving social protection, but it is not a direct indicator. So in that case, when we did the exercise, we didn't include it because we wanted to mimic or be close to the framework of the Egyptian MPI, which again is currently being finalized, I have to say. That's it, just a quick remark from my end, and back to Hassan and Vlad.
Thank you all so much. Go ahead.
Yeah, just one final point, Paul, Professor James. For the income, yes, Khalid mentioned it right. It wasn't part of the framework. However, However, we have used the income from the hikes in our clustering exercise as a proxy to cluster the different type of households. This is the last slide where I showed how was it efficient or not. And for the political impact assessment point, as in Lebanon, we totally understand. Yeah, thank you. And for the final also slides and the example you stated on the biplot, it's really interesting and we can think of it. Thank you, Paul, for that.
Great. So I will say that income is a fleeting element of a person's well-being. It can come and go. And unfortunately, in history, income put into poverty measures has often led to direct transfers that continue year after year. So there are some negative sides of including income. On the other hand, if you're talking about a person's earning capacity and their ability to earn their own income, I consider that to be as important as any other dimension and should be included. If you can get the data, many times one cannot. But it goes both sides. You really can see pros and cons of including income. I personally am right down the middle. I'll be happy to listen to arguments both ways. Now, let me look into the chat and see who is there. I see a clarifying question from Susanna. How do you know the MPI contribution? Is this how an indicator contributes to the total MPI? How can that percentage be interpreted? So if you'd explain that first, that would be great to our listener.
Yes, as I said, the uncensored headcount focuses on the number of deprived households in a certain indicator. The censored focuses more rather on the deprived and poor household in that indicator. And the contribution add to this aspect the weight of each indicator. This is the main normative assumption. For example, in the case of Palestine that Professor Paul was talking about, they set it as 20%, which is quite close to the poverty threshold in itself. So the MPI contribution, of course, regardless of what's inside, will be highest contribution from the income poverty, which is where they set it as a really high. Out of 22 indicators, this weight was 20%, which is really high. Yeah, so this is, do you want me to continue with the comments, Professor?
Well, I'll go ahead and read off the next one, and then you can go ahead and answer it. This is from Ricardo, who's at OPHI. Thanks so much for your great presentation. By the way, I didn't say that. Thank you also from me. I'm very inspired by the good work that you do, says Ricardo. Do you think there's any way to include some behavioral aspects to the model consequences of a flip? I'm thinking of exiting deprivation in some indicators, for instance, unemployment, which may have almost immediate consequences on other deprivations, depending on the context, labor, child labor, asset deprivation, school unattendance, etc. Probably this modifies the cost effort of a flip considerably.
Yes, from a modeling point of view, this can be done under certain assumptions that we have to do. So the point of Ricardo is about the trickle down. If I do an effort in a certain indicator, does it trickle down to other indicators? From a theoretical point of view and exercise, we can do that, but it's not easy to measure it. This is the real issue. You can add probabilities to it and computation of probabilities, looking for historical data. It is challenging. Vlad and Khaled have some comments.
I think it depends on the circumstances and on the country setting, and it's not impossible to do. And actually, so we have tried two extreme scenarios where the indicators are independent. So the policymaker targets one of them and no other indicators are affected. We also tried perfect dependence of indicators within dimensions. So if you target school attendance, then school
other school type indicator,
other school indicators get affected at the same rate, or in some fixed rate, but other dimensions, let's say, remain untouched. So this is I think that this is a very useful discussion And we have these discussions with our member states when they are choosing to try this model. Then we get into these dynamics: what should be modeled, what costing should, how the costing should be parameterized, and so on. Khaled?
Yeah, I mean, just to add to this point, in fact, that was the first concern that we had. What is it, a year and a half ago when we started this work, or maybe even slightly more. The independence assumption, which we of course know is unrealistic. And my concern was that I knew that this the interlinkages exist, and I knew that we could probably model them, but you would have to then contextualize, just like you do in a a CGE model or any other model that doesn't assume independence. You'd have to contextualize it to the country. And that would entail a significant amount of effort from our side. So the idea was to start with this framework and this model, and then possibly as an extension, we could do that. Once we've, gotten this discussion with the member states, because the biggest challenge that we had actually was when we implemented this in Palestine, Egypt, and Iraq also ongoing, and the discussions we have with the cost per flip, it's not easy to get these costs per flip. And in fact, we were even thinking of having a separate model just to help the decision makers decide on how to estimate these costs from all the budgetary, the information that sometimes is not readily available. So it is a complex process, and we're not claiming that this is trivial by any means. But at least let's get this right, okay, including all of the difficulties that we have right now. And then as a possible extension, I think it will be important to look carefully at this independence assumption and try to relax that whenever possible. So that would be my 2 cents on this.
This, I want to just quickly add that, yes, this issue of costing and choosing which indicators are so-called active depends on the particular situation. What is the time window that we have in mind? Some indicators can be addressed within several months, years. Some will take a decade. And some indicators will always remain inactive because there is nothing that policymakers can do in the short time frame. So yes, so the parameters about costs depend on what the policymaker is interested in addressing and achieving.
Well, great. That's a very interesting discussion. I want everyone to remember that part of what you're doing is just reordering which particular deprivation is going to be focused on, reprioritizing in a way that is most effective in the short run. Of course, in the long run, if we take a perfect world, we'd want to get there where there aren't any deprivations for any poor people, and perhaps even no deprivations for non-poor people, but that's a different overall goal here. I have a couple more questions, and I'm going to let it go over maybe for 5 minutes since we started just a little late. And the last couple of questions is from Eleni. First, the question was, how do you take into account, or did you take into account, persons with disabilities in this particular work? I know we've had many works where people with disabilities focused on in MPI, but this particular one, that'd be the question I'd have for you. And then a follow-up to that by her was, just reflecting, this is a reflective question, I presume. What's the most challenging aspect of this work?
Yes, so for the most challenging aspect is what Khaled mentioned clearly, it's the costing issue. So mainly two things, the data, from where do we get data, and then analyzing the data to see how the relative cost per indicator changes and what are the priorities. It's not easy and straightforward. So this is it. And regarding disability, Vlad, you have something?
Yes, definitely. We to the extent that disability status or statuses are in the MPI framework, we consider them. One question there is whether these indicators would be what disability. What type of a disability is involved, and whether it can be activated with the resources and the time window that the policymakers have.
If I may just come in on this,
please,
just very briefly. Yeah, I mean, again, to repeat what Hassan and Vlad have said, disability is obviously very important indicator, especially in this region where we have, unfortunately, conflict and ramifications. But sometimes the information is not there in the surveys to the extent it allows us to readily include them in the framework. And again, this framework is based on a national discussion, so how they're included is obviously back to the decision of the policymakers and the stakeholders. But the more interesting question for me is the challenging question. What is the most challenging part? I would say, and maybe I'll differ from you, Hassan, here, that maybe one of the most challenging parts of doing this work is to decide on the target poverty reduction, because very often this is a political decision, right? Mm-hmm. And what we did in the case of Palestine was actually we decided to tell them, hold off on making a political decision on the poverty, the MPI reduction target. Let's have a consultation. Let's ask each ministry, line ministry, what is a feasible poverty reduction target that you can achieve in this particular indicator? So we had 10 different line ministries discussions. And then we shocked the MPI. So we had a simulation on the MPI, assuming that these targets were met individually, and a simple Monte Carlo simulation gave us by accident 46%. So we went back to the policymaker and told them 50% would seem to be feasible and attainable if your individual indicator targets are met, which are already seen as feasible by the line ministries. That's not a trivial task, and it's certainly much better than to just have a political decision that is not evidence-based. So I would say that is one challenge that I would say has come up in the process of doing this work. So again, my concluding remark is all of this work is challenging, starting with the definition of the MPI and building consensus around it. Going into the costing elements and the modeling aspects, choosing which model to operationalize, but also setting the target. And of course, eventually implementing all of this, which is the hardest part of all. So I'll end with that, and back to you, Professor J.
Great, thank you. And I just wanted to see if there was one final word from Paul, who's been hanging around the side while we've been discussing this. Paul, is there anything that you'd like to chime in with at this point before we bring it to a close?
I think everything that needed to be said have been said, and I'm really happy with the explanation of Khalid and Hassan. I'm comfortable with this, and with your explanation on income. Actually, it fluctuates more than other dimensions, and on this, you're all right.
Well, thank you so much, and I really appreciate your comments, Paul. Obviously, Khalid, so great to have you here joining us. And of course, to the presenters, Hassan, Vlad, really appreciate all of your contributions today. That brings us to a close for today's event. Be here next time, next week. We'll be discussing a very interesting paper by some colleagues of mine in the London School of Economics, where I'm currently visiting, on using a multidimensional approach to talk about employment conditions and the quality of a job. Okay, that's good enough from London here, from all across the world, Oxford. Thank you so much for being here. We'll see you next time.